Hey everyone, and welcome to another episode of the Diagnose Brave podcast. I'm your host, Bethany, and today I wanted to talk about my knees. Now, as a disclaimer that I'm trying to put in my videos, I am not trying to diagnose, treat, or tell you what to do, right? I'm not a medical professional, but I wanted to kind of share a timeline of my knees for anybody who is experiencing knee issues and maybe not sure where to start or what to do or need some encouragement on the topic. But mine starts a long, long time ago. I had started noticing some knee pain back in high school. I was on the basketball team and it continued through college. And pretty much they were telling me it was the wear and tear that I was putting on my joints. So I would do the ice baths, I do the Advil, and I would do some physical therapy during that time. When I got out of college, I started noticing, the knee pain was still there. So I went and saw an orthopedic surgeon and they did x-rays and they told me that, yes, I had a lot of wear and tear from the sports over the years and that mixed with some weight gain that I had gone through, that was probably what was, causing issues with the joints. So they suggested that I see a pain specialist and, maybe try some physical therapy again. So that kind of kicked off what I would call like my adult part of dealing with my knees. That experience with that orthopedic surgeon, that was like the first one I kind of had. And so I tried to find out more information about this. What could I do because of the fact that I was 23, 24 and experiencing all this pain? It kind of worried me, right? Because knees are pretty important. Even when she was saying like, oh, well, it'd be great if you could lose some weight. It was like, yeah, it's pretty painful walking, doing any activity. So yeah, losing weight's going to be really easy when your knees are feeling pain. So that definitely came to be helpful with not only the medication, but then the physical therapy that I had. I was during that time diagnosed with my autoimmune disease and put on a plethora of medications. And so you fast forward a couple years and I go to another knee doctor and talk to them about, what the previous one had said years ago. And their comment was, yeah, but see, here's the thing now, because you've been on steroids for so long, we are detecting osteonecrosis, which is pretty much like a dead bone disease. The blood supply can't get to it, so the bone actually ends up dying, which means that there's really not too much that they can do to relieve the pain. It's just mainly to keep you comfortable, let's say. So, with that new information, I decided I really need to find a way to continue exercising and continue participating in life because at this point, we're not talking about just some swelling, like, we're talking about dead bones, which is a whole nother category, right? And they explained that with the medication, that was a side effect that they saw a lot of people with, and it could affect different joints. And mine at the time were just affecting the knees. So I followed up with those doctors and just kind of like got things the best I could. Over the course, I would say, of probably 5 years, I got different sorts of injections to try to help with the inflammation. Sometimes they would pull fluid out just to help get the inflammation down because it would just bubble up like around the knee. To the point where in about 2017, I found out I had a meniscus tear. And so the surgeon said that they could go in and kind of scope out the knee, repair the tear, and, see how it feels from there. And I got that done in 2018. And I was really impressed by how much better the knee actually felt after that procedure. I seemed to get a lot more mobility in, which definitely helped me be able to work out more to help with the weight, to get some of that weight off the knee. And just like with everything, it's kind of like a temporary fix because again, when you're dealing with wear and tear on a joint, and the cartilage starts going down, or you've got osteonecrosis, there's only so much that they can do. And so again, they just want to kind of make you comfortable. And for me, after being on pain medications for so many years, like I had decided that I needed to try something different. I needed to step away from it. And so I kind of again reevaluated my options of what I could do. I had been interested in knee replacement surgery, but they had told me that because of my age, it's not something that they really do. So I just had to kind of wait. Part of that waiting is what was driving me crazy because I had pain. And, you get little relief, or some days are good and some days are bad. But living in the Midwest, obviously, when the cold comes, whew, do you feel it, right? So I continue that, going in, checking in, getting imaging done, and keeping an eye on everything. And so that kind of fast forwards us a little bit. And I ended up going to see the doctor, and he said that the osteonecrosis was spreading and that the cartilage was definitely thinning, especially in my right knee. And so they fitted me for this unloader brace, which in my mind, the first thing I thought of, like when I saw the brace, was Forrest Gump. I mean, this thing goes from your upper thigh all the way down to your ankle, and you have to wear it against your skin. So it's ridiculously difficult to try to wear it under jeans. And so when I could, I'd wear the brace, and it did bring me some relief, but I couldn't wear it all the time. And so it was just, again, just trying to find a lifestyle balance with everything. After a while, I would say that the cortisone shots kind of stopped working. The gel injections kind of stopped working. They gave me another big brace that was more spring braced to kind of like help with my thigh muscle. Because sometimes when you're having knee pain, you're not really utilizing your whole leg functionally the way you should. So they were telling me that I was going into somewhat of like an atrophy with my upper leg. And so I was like, no, we don't want that. So they gave me another brace that's spring loaded, still kind of system where it's pretty cumbersome. It has a box that you have to carry it in. So that just kind of gives you an idea of it's not something you can just throw in a bag and go. But I continued with everything that the physical therapy had shown me because stretching and things like that were really beneficial. And I did get some relief from that. This past year, it kind of took a turn to where waking up during my sleep, I would wake up with the knee pain. I mean, just really an inconvenience. It wasn't just, oh, it feels sore, oh, the weather's this way, or today's not a good day. It was kind of like almost constantly yelling at me. So I went in and they were like, let's just try one more round of injections, see what happens. Gave me that new spring brace. Let's kind of put our heads together and see what we can come up with. So I had my follow-up appointment. I let them know that I wasn't getting any relief from these things, and I didn't know where to go. So they said their best bet, if I didn't want to go back on the pain medication route, was they could put in some nerve blocks, and possibly even go ahead and cauterize a lot of the nerves in my knee so that I wouldn't feel the pain from it. Now, contrary to what some people think, when they do go in and cauterize the nerves, it does not mean that you can't feel your leg or you can't. It's just the certain ones that send the signaling to your brain that, like, oh, there's pain. Those are the ones that they're able to pretty much burn off. And I had this done in my foot a number of years ago, and it really helped. So I was like, well, maybe that's something that's on the table. Let's try it out. So I made an appointment to get the nerve blocks in, but I was still feeling like, is this really as good as it's going to get? Here's this doctor that I've had for a while, whom I trust, and who's telling me that, we're just trying to push off the knee surgery as much as we could, because in his opinion, the knee like replacement is really only warranted for about like 15 years. And so we can't do it now because you would hopefully outlive the knee. And so I thought, you know what? I got to follow my own advice. And so I was headed a couple weeks out to my normal trip to Cleveland to see all my doctors out there. And so I was able to squeeze in to see an orthopedic doctor out there. And I thought, okay, I'll bring my images and see what they have to say. Because again, the reason why I go to Cleveland a couple times a year to see my specialist is because they specialize in vasculitis. And so they have the latest and greatest. And then after a while, it trickles out to all the other doctors. And I know I've shared in other videos, it always cracks me up. Like, I'll have my doctors from Chicago be like, oh, yeah, I saw your doctor from Cleveland at this one speech, or yeah, like, they were giving this lecture and they were sharing about the latest and greatest for this and that, and so you already know in your head, like, okay, if there's a way, or if they've figured out a new breakthrough, like, they're going to have it at Cleveland. So I had the appointment, and before the appointment, they decided to do their own x-rays. I mean, every orthopedic office does that. And I get it. I mean, they want their equipment used and they want their people to, do the whole workup. But shortly after I got the x-rays, go in and see the doctor, and the doctor's like, hey, can you tell me why you think you're here? And I'm like, oh, let me tell you, my knees are not the greatest, and I'm looking for some suggestions and what you would think. And he's like, okay, good. At least you know. I was like, yeah, that part I've been told. I was like, and since, I can't have the surgery, like, I just want to find out, like, what could you guys offer? And he looks at me and he's like, why can't you have the surgery? And I said, oh, well, they told me about 15 years, knee replacements are good for. And he's like, oh, he's like, I'm really sorry they said that. He's like, when I do knee surgeries here, he's like, they're warranted for like 25 to 30 years. He's like, and if the plastic part that goes in between, that acts like the cushion, like the cartilage does, he's like, if that wears out, he's like, we just go in and put a new piece of plastic in there. He's like, so I'm really not sure what the problem is. I was so overwhelmed. I was so overwhelmed. It was to the point where I actually started tearing up, because here I had been thinking there was nothing, no relief, or I had to make a decision on whether, I wanted a couple good years or not, or I mean, just everything that can go through your mind had gone through my mind previous. And then here I am sitting across from somebody who's like, okay, yeah, you're bone on bone, so your only option is knee replacement. And when would you like to schedule that? And it was like, holy cow. So I asked him, I said, I haven't really looked too much into the knee replacement because I thought it was just such a far off, kind of thing. Is there anything I won't be able to do after the knee replacement? And he's like, well, some people say that they can't bend down on their knees afterwards. He's like, but pretty much the top two are just no bungee jumping and no skydiving. Well, it has been a bucket list item for probably 10 plus years to skydive. And unfortunately, for a bucket list of reasons also, I have never been in the weight category I need to be to do the tandem skydiving. And this year I was able to get to it. And so that was something that I was looking forward to getting a group together, or at least picking some dates to do. So I was like, well, hold on a second. If I can't do that afterwards, I got to try to fit it in beforehand. And he got a kick out of it. But yeah, I mean, we were able to actually schedule the day for it. I left there. I felt so good, just so unbelievably good, that I had somebody who not only listened to me, but gave me some great information. I came back to Illinois, and I had some more PT that I was going to do. And in doing so, I ended up coming across the orthopedic surgeon I had at home. And, they were like, oh, how is everything going with the PT and, your new brace? And I was like, well, actually, like, the PT is helping, but it's kind of like a Band-Aid on the problem. And they were like, oh, well, in that case, if you don't think there's no other option, like, we could go ahead with the knee replacement surgery. And I was like, unfortunately, because of the conversation we had a couple months ago where you told me you wouldn't do a knee replacement, I sought out another surgeon, and they told me that they would do it. And so I scheduled it. I was like, so I have that up and coming. And definitely, just like, with most places, they get a little taken back that you went somewhere else. But they were like, okay, we understand, no problem. And my hopes in sharing that information with them is not because I wanted to say, like, I didn't think you were a good doctor, because great doctor and a great office and everything. But maybe next time, instead of just telling someone, like, well, it's only good for 15 years, so we can't do it, even if that was the case, maybe the type of surgery that they do compared to Cleveland does only give them 15 years. But here's the thing, like, being diagnosed with something where they gave you a time frame, and I have been so blessed to blow right past that time frame. Like, I'm here. It's going to be almost 18 years next year of dealing with Wegener's granulomatosis. Telling someone that, oh, well, the medical device is only warranted for 15 years. Like, okay, well, I wasn't supposed to be here after 3 years. So what does that mean? How about relief? How about the fact that I don't have to wake up in pain constantly? Um, isn't that worth something? So the reason I shared it with, the doctor from home was because I was hoping he'd really kind of reconsider the way that he would approach other people that are young, that are coming to them time and time again and saying, oh, I have this knee pain. Now, some people have told me, well, probably the reason they didn't want to do the knee replacement is because, you could have been a patient for life, right? You just come in every couple of months, get your injections, do your PT, and then, if they fix it, then you don't need that. I try not to get into that debate as much, because that can be a double-edged sword, and I try not to assume why people are doing things. I just try to gather the information and then make the best choice that I can for myself. And so, yes, when that surgeon from Cleveland said not only are they warranted longer, but that they can easily fix it, it was like, well, wait a second. If I could have pain relief today, like, sign me up. Absolutely. Like, that's hands down, that's an easy decision for me. So I would just share that when you're trying to seek out answers and you're trying to get more information about any aches or pains or anything that, is being brought to your attention that your body's talking to you about, that when you go see a doctor, like I've said in other episodes, like, it's not a bad idea to get a second opinion. I mean, I guess in retrospect, I maybe should have gone to see a second opinion about my knee. I just had a lot of faith. I had a lot of history with this doctor. And so I figured, let's see where this goes. But yeah, when it came to a point where it was like, we no longer have an answer for you, then that's definitely a light bulb moment of, okay, let me just get a second opinion and make sure we're all on the same page here, because everybody practices different, like, medicine, and they do it in a different way, and that's okay. But that's why there are multiple doctors, and that's why most of the time I found insurance covers second and third opinion. So it's not a bad idea to have that consultation and to see what they think. I mean, for some of my surgeries, I've seen 5 doctors before I felt like I found somebody that I felt comfortable with and trusting my care. And that happens. And so having the reassurance from Cleveland saying, like, oh no, we can do this, let's get this scheduled, not trying to push me off or, tell me, like, oh, we'll just keep doing injections and you can keep wearing the brace. Like, I would tell them, like, you can't drive with the brace on. And because of the way that you have to buckle the, like, 4 or 5 straps and all the little knobs and things like that, like, I can't drive to the store and then attach it and walk around the store. I mean, if it was that way, then, hey, maybe I would wait a little bit before doing the surgery. But it pretty much was just something that either in the summer I could wear with shorts or around the house. And so it wasn't as user friendly as, maybe other people find it to be or can use it to be. It did buy me time, and that was something else the Cleveland doctor pointed out. He's like, you've been having knee pain since like 2000. Like, you've done everything you could do. You've had the injections, you've done physical therapy, rounds multiple times. I practice it at home. He's like, you got the weight off, like you did all the things you needed to do. Now we're at the point where it's just bone on bone. And so there's really nothing that is going to fix it. There are things that can, again, buy you time, make you a little bit more comfortable with it. But at the end of the day, when it's bone on bone, like there's nothing they can really do. And I heard people talk about like, oh, well, my knee locked up. Usually older people told me, and I'd be like, oh, it hasn't gotten to that point yet. That's fine. Well, probably the last couple of months, like, yeah, like it locks and it's amazing because when you go to like unlock your knee, it is an instant second of burning, stabbing pain every single time. So whether I'm standing and I move to sitting or I'm laying down and I move, just any different movement to that knee would lock it. And they were like, you have no cartilage left. So there's nothing for it to like brace itself. So you're just click, clack, constantly. And that's why it's locking. And it was like, oh, okay. Well, if we're to that point, then yeah, we definitely need to look into having surgery. So I just want to empower people who are experiencing any knee issues that when you go see an orthopedic surgeon, if you're not getting the answers you want, or you want to make sure that, the person you're talking to is giving you all the information you need, definitely not a bad idea to set a second opinion on it. And then also, it's not bad to just advocate for yourself to say, okay, what else is there? During a time period, and they were just giving me like pain medicine. Well, pain medicine does serve a purpose. But when you're on controlled substances for years and years and years, just like with any medication, there's side effects. And there's other things that the pain medication can do to your body besides bringing that relief. And then it comes like you get used to it, and then it's like they got to increase it. And then it's to the point where you're taking, an extended release, Oxycontin around the clock. You're adding in, Vicodin to cover the breakthrough pain, and then you're adding this muscle relaxer, and then on top of the other medications, and then it's called like, hey, try to function. Like, okay, I mean, my medications all say I'm not supposed to drive, I'm not supposed to do this or do that while taking, and I'm supposed to take this around the clock. And at the time I was working a full-time job, and it was like, this doesn't really add up. This doesn't seem like the best solution for me right now. And so it's okay to question it. And it's okay to ask. I mean, I've got a stack of the MRIs that I've had done about my knees over the years because I wanted to make sure when I had a new pain or when it was more severe, like I wanted to make sure like structurally that it was okay, because I didn't want it to come to a point where they were just like, oh, now it's so bad, we have no option, we have to do this. I wanted to try to see like what could benefit. And I did try not only the physical therapy, I did like acupuncture, I did different type of like heat and cold therapy and things of that nature in the in-between time. So there's a lot of other things, even chiropractic care, to try to help offload the joint discomfort that I was having. But ultimately, yeah, I did get to the point of, after so many years of dealing with it, that the only solution I see is to just completely fix it. And so, they told me it's really not that bad as far as a rehab. It's just a couple of weeks. Unfortunately, it is my right knee. So of course, driving is going to be challenging, and I'm going to have to figure that aspect out. But it was just reassuring to know that it's something I can get and that there's a possibility of having some relief. Because a couple months ago, when I was feeling, some sort of way of like, well, I guess this is it, I just have to deal with this, horrible pain, because I knew, again, even if I went on the pain medicines, like it's not going to solve it 100%, And so what could I do? Is this going to get better? Or no, the pain just keeps on getting worse. Like that's what was messing with my mind as far as like, oh, there's no options. Like, yeah, there are. You just have to take the time and have the energy to look into those things. And so I, again, just want to encourage you guys to put yourself first and seek out information so that when you do have someone who says like, I think surgery would be a good idea, or I think this procedure would be a good idea, that you have all the information to make the best decision for you and feel confident about it at the end of the day. So hopefully, my goal is to have the knee surgery sometime this summer, and I'm going to continue to do the physical therapy until then. But, it's part of a mental component, not just the physical. And so, mentally knowing that this time next year, this isn't going to be an issue really, really, really helps. Those moments when the pain feels too overwhelming, or I feel like the quality of my life is not where I would want it to be. I just know, okay, there's a timing, we're going to get it fixed, and I have some answers. And that definitely helps me persevere mentally through the pain and the discomfort, and possibly the days where I'm not able to walk the dog as far as I want to, but I know this too will pass, and I'll be better in the end for it, because I'll have a knee that definitely works, right? That's the end goal. So I just wanted to give a little summation about my knee experience, and if there's any questions or comments you guys have, I don't mind going into things in further detail. I just didn't want to bog it down necessarily with a bunch of details and then people be like, yawn, I'm bored. So I thought an overview would be helpful. So that was my goal for this. So thanks for checking this out, and I hope you guys have a great rest of your day.